Greetings. Let us talk about the role of cholecystectomy in a patient presenting with gallstone pancreatitis. I'm grateful to my mentor, Dr. Stroline, Mr. Charles Butt, Ms. Angela Deal, my institution, and my mentors. Please read this notice. So we all know that small stones, when they escape from the gallbladder and come down the bile duct and block the ampoule of water, it can precipitate gallstone pancreatitis. But most of the time, these small stones pass down the duct into the duodenum and actually clear the duct. So when you're dealing with gallstone pancreatitis, you have to figure out whether you're dealing with mild interstitial pancreatitis or the patient has developed severe necrotizing pancreatitis. And you also need to ask whether stones are still there in the bile duct or not to plan your management. So here is a patient who was admitted with gallstone pancreatitis, elevated amylase, lipase, typical pancreatic pain, along with gallstones on ultrasound and elevated liver enzymes and bilirubin. The patient has improved within the first 24-48 hours with aggressive intravenous hydration, and you want to decide what to do next. Because the pancreatitis is getting better, should you consider doing an ERCP procedure to clear the duct stones, or should you send the patient to laparoscopic cholecystectomy? So what we know is, in the setting of mild gallstone pancreatitis, if the patient has fever, chills, rigors suggestive of cholangitis, or persistent obstruction of the bile duct because of a stone stuck there, manifesting as jaundice or a bilirubin of more than 3 or 4, or when you do an imaging study, you notice a stone in the bile duct, either on MRI with MRCP or ultrasound or one of those imaging studies. So in the setting of cholangitis, jaundice, or stone in the bile duct, you should consider ERCP. ERCP is typically done within the first 24 hours and clear the bile duct of the stones so that you prevent recurrence of episodes. On the other hand, if the patient presented with gallstone pancreatitis and you notice that it was mild, but the patient had no cholangitis and bilirubin normal or mildly elevated, but no stones on imaging study in the bile duct, either MRCP or CT scan, preferably MRCP. In that case, you know the bile duct is clear, stones pass down the bile duct spontaneously out into the duodenum, in which case you send the patient to laparoscopic cholecystectomy. In terms of laparoscopic cholecystectomy, when should you do the procedure? So patient has come in within 24-48 hours, improved from pancreatitis. It is best to do laparoscopic cholecystectomy before discharging the patient during the same admission. On the other hand, if you have a patient with several comorbid conditions, diabetes that is not controlled, maybe heart failure, or maybe COPD or something that is not yet fully controlled, in which case you take a couple of weeks to optimize the medical management, but preferably consider laparoscopic cholecystectomy in those patients within 2 to 4 weeks. So how about if you have a patient with gallstone pancreatitis that appears to be severe, necrotizing pancreatitis with fluid collections? In those patients, you do not send the patient for laparoscopic cholecystectomy because surgery will be technically challenging with so much of edema, not able to dissect out the planes, and unnecessarily cause infection of the fluid collections, etc. So you delay the cholecystectomy until a few weeks down the road when the fluid collections resolve and get organized either into a pseudocyst or walled off necrosis before you consider cholecystectomy. So I hope this is helpful. So in summary, when you're looking at gallstone pancreatitis, think about whether there's any evidence of stone in the bile duct, either cholangitis or elevated bilirubin or a stone on imaging study. That will help you decide whether you need to do an ERCP or not. And then you also look at whether it was a mild interstitial pancreatitis or severe necrotizing pancreatitis. This will help you decide about the timing of your laparoscopic cholecystectomy. In mild interstitial pancreatitis, same admission. Necrotizing pancreatitis, wait till the fluid collections and necrosis becomes walled off. Wait for a few weeks. Hope this is helpful. Thank you.